Hello, I'll be taking you through citrated platelet poor plasma. Plasma is the liquid part of blood that is obtained after centrifugation of blood with anticoagulant. Accuracy of hemostasis, that is coagulation testing, depends upon the quality of specimen obtained, and since platelets contain clotting factors which can activate the clotting cascade, most coagulation tests require submission of platelet poor plasma. And to obtain this, double centrifugation is required. So the procedure of obtaining citrated poor plasma, you need to use a light blue tube that has an anticoagulant that is citrated, sodium citrate. This sample is required for coagulation assays, that is factor 8, factor 9, and this is for assessment of hemophilia, protein C, protein S, and lupus anticoagulant, etc. The sample is collected in a light blue tube in a ratio of 1:9. That is 1 part of sodium citrate, the anticoagulant, and 9 parts of blood. When you are collecting this sample, avoid stasis and contamination of specimen. Ensure that this sample is filled to the mark, and it depends with the kind of tube that you are using. If you are using such a tube, this is the mark. Also, if you have such kind of a tube, you have to fill up to this mark. And also, if you are using this kind of a tube, it has to fill up to this mark. Once you have ensured the sample is filled to the mark, gentle inversion 3 to 4 times. That is mixing 3 to 4 times. Check for any clots before centrifugation. Once you've confirmed there is no any clots, centrifuge tubes at 1500 to 2000 G. This is not synonymous with revolution per minute for 15 minutes. To convert this speed into RPM, one should use an RCF, RPM, nomogram, or calculator, since the RPM settings will differ between centrifuge types. Once you've already centrifuged your sample, ensure that you have 3 layers. The top layer, we have platelet poor plasma. This is the top layer. And then you're going to have the middle layer where we have a high concentration of platelets. Then we have the sediment, where we have a high concentration of the cells. We are going to separate our platelet poor plasma in a clear tube without any anticoagulant. Ensure that you pipette the supernatant without distorting the Buffy coat. So you're going to label your sample. You label your sample with 2 patient identifiers. You can have the name and the visit number of the patient. Then you will take this sample, once again centrifuge for the second time at a speed of 1500 to 2000 G. You can convert this to revolution per minute and centrifuge for 15 minutes. Once you have centrifuged your sample, you will take 3/4 of this without getting to the sediment where we have a high concentration of platelet. Ensure you observe the centrifugation pipetting techniques. Once you have your sample, label this tube with minimum 2 patient identifiers, the patient name, the visit number, and indicate that it's citrated platelet poor plasma. Ensure the volume is sufficient for the tests that have been requested by the clinician. Cover your tube with a parafilm to avoid any spillage. Once you're done, freeze our citrated platelet poor plasma until it is ready to be transported.